So let's go to this. I'm a fourth year medical MBBS student right now and have already started with the language. Will it be possible to pursue PG in Germany around 2028, or a job market will get saturated? Now, 2028 is very far away. No one has that. In German, it's called Glaskugel, the ceramic, the glass bowl where one can see the future. So giving you exact prediction would not be possible, but certainly the population in Germany is also aging. In 5 to 10 years, next 5 to 10 years, one expects that 20% of the people will be, or 20% of the doctors' population will be in the retirement age, and then definitely in any time soon, I don't expect that the job market will be saturated here in next at least a decade or two. All right, going to the next one, how to plan for medicine and critical care training in Germany when one is already preparing for PLAB. Here I would say that you finish preparing for PLAB and then you can prepare for Germany if still need be, because preparing for both things at one time is not a good idea. Both things are totally different. For medicine and critical care in Germany, you'll have to learn German and go through the entire pathway that I have told you, and PLAB is totally like you have to study for that exam. So prepare one thing first, finish that, then move to another if that does not work out. If that works out, well and good. All right. Then, does Germany have better learning opportunities as compared to India in a surgical residency? Now, this question comes very often, and since I work in surgery, people ask me this, that how would my skills or my training compare to my colleagues in India it is. So here I would say that since I've worked in India also in government college. So the number of surgeries, the number of things that people do in India is too much. I mean, very, very high. The volume is very high compared to Germany. The residents there, first year residents, second year residents start operating without any supervision. So that is there. But there is also a reason that people completing a residency over there, and after that they come for fellowships to developed countries, for US or UK or Germany. So I believe, I cannot compare, I have not compared my skills with those surgeons in India, but I believe that more operating is not always good operating. So in that, I will leave it at that. Like, so, okay, here the surgery that one as resident one does is less, because of the patient security matters, because of the hierarchy. The system has been like this here, that the people who are in advanced stages of the training, and after the training they operate more, and the younger residents don't operate more. Yes. So next is about, also tell us about BDS doctors. So the entire presentation that I did is similar to BDS. I mean, the BDS doctors, you can replace the word doctor by a dentist in those presentation. Only thing is that for BDS job search, I mean, you don't have to write to the hospitals. You have BDS dentistry is basically practice-based department here. They have private practices. So you have to write to them on the email addresses for jobs and all. So otherwise the process remains the same. Only the name of the office changes, where you apply and everything. But most of the information is identical. After completing post-graduation in Germany, if we complete fellowship in same department in UK, is it valid in India to work as a specialist doctor of respective department? Here, I would also take from a doctor from UK, Dr. Kanhaiya, if he has some input on this. In my view, yes, because one has here we assume that one has MBBS from India, a primary medical license from India, then a residency from Germany, and then a fellowship from UK in the same department. So with this combination, with the end qualification from the UK, which is recognized in India, a person should be able to practice his trade in India. That is my view.
Very good.
Can we allow Dr. Kanhaiya to say on this?
Yeah. Trying to unmute Kanhaiya ji. Just a second.
If somebody who is a medical graduate from the UK, they are licensed to practice in India anywhere. Even if you have the fellowship or mastership from here, it is valid there. Though they are not giving any preference to that. Initially, when I was a medical student, if somebody 𝗪𝗔 or FRCS from UK, they have been given 6 points straight away. But they are not giving now, because the MS and MD has been disqualified in UK. But still there is some weightage in the public sector. If you have some fellowship and mastership, they give you some preference. But MBBS from UK, they can practice in India without any problem.
All right. All right, then moving to the next question. After completing post-graduation in Germany, is German medical license valid in other European countries? Yes, it is certainly valid. Even the medical license and even the FACAS is valid. Does having FRCR in oncology, step 1, helps my pathway in Germany, and how? I don't think how it should, I mean, it will not help your primary pathway, because you have to apply for Fachsprachprüfung, you have to apply for Kenntnisprüfung, these exams to get a primary medical license in Germany. But when you apply for Gutachten, that means recognition of your experience that you have achieved so far, there this can play some role, but don't hope too much on this. It can give you a little concession of 6 months or 1 year from your residency as a radiologist in radiology in Germany, but it will not help you too much. If you have here, I would say exam passing will not help you much. If you have experience, then certainly it will help you. What is the age limit for the course? No age limit. I would like to know the basic requirements for someone who is medical practice after finishing the study. So here we have talked in detail about this, so we will not take this question anymore. I wish to know whether legalization or apostillization of relevant documents from India is mandatory for approbation process in Germany. Here first I will take the first question. Legalization, apostillation, as I have mentioned in my presentation, you cannot do that. Apostille you can do, but you should not do that. You will be wasting your time and money in that, because in Germany it will not be recognized. The process is that the German authority will be doing it for you. You have to send your documents directly here. The second question is that though some states in Germany provide free language courses, those inclusive of to prepare for FSP and KP. FSP and KP you get language courses. For FSP and KP courses you can get, there are institutes which offer sponsored courses which are sponsored by the government in Germany. Obviously there are some criteria and selection procedures for that. Language courses is very unlikely. Obviously depends upon where you come from and what situation you are in. For example, if you are someone from say countries who is migrating here, for example Syria or other country who where the asylum problem is going on, so those candidates get everything from the government, okay, because they don't have any like other resources. But people who come from a resourceful country, they should pay their own fees. That is the view from the government. Medical from Germany or UK, which one is recognized better? I mean, both are recognized better. So it depends upon you which one you like more.
So Deepak, I just want to add here that the advantage is that once you do in UK, you can directly go and practice in India. Whereas if you do from Germany, you have to pass this next exam. This is what I understood.
Yes, for MBBS, yes. Medical,
yeah,
when you say
for
medical,
MBBS.
yes, MBBS, yes.
Yeah. So that is the advantage.
Also advantage is that in UK, you do everything in English, and in Germany, everything is in German. That's why, in my view, selection rate is a little difficult in Germany because of the language barrier. It's not like people don't do it, but it is difficult. And UK, that would be a luxury, I would say. But the costs are then the negative factor.
Yeah.
I have done FCPS in Gynae from Pakistan. Which of both countries better to pursue career on basis of work-life balance for mother of a child? I don't know about the systems in the UK, but in Germany, Germany is a very social, country, very friendly to family care. So in my view, Germany is a good country for a person with who seeks a good work-life balance. I don't know about the UK.
You want me to answer that?
Yeah, maybe you can elaborate couple of sentences.
From certain degree from Pakistan, it is recognized here. Some of the, because I know some of my colleagues, they have done some post-graduation there, and they have been straightway accepted in the UK. But from India, there was some problem in some part of the India, and after seeing some of the videos, they have de-recognized all the MBBS degree, and that's how the flag started in UK. Though I came under in the UK under double-ended sponsorship, what Dr. Sinha mentioned, that one of the sponsors from India can sponsor you, or one of the sponsors from here, they accept you. So because I was MS in India, so they accepted me here. But we had to come through the double-ended sponsorship from Pakistan. Some of the degree are state recognized in UK, and they can get GMC registration and they can work here.
All right.
Thank you.
Wonderful. Then we go
But just want to add here that, as Deepak said, that so Germany is at least a good country that I see that there is a very good work-life balance.
Yeah.
I'll interrupt here because Dr. Kanhaiya is also on the line. There's a question from GJ who says that what are the steps to work in UK after finishing post-graduation in Germany, considering the current situation with UK not being a part of Europe now?
The question that what are the steps to work in UK after finishing post-graduation in Germany, considering the current situation with UK not being a part of Europe now?
I mean, I don't have the right answer for that because Dr. Sinha is the right person and giving that. But what I believe that some of the German doctors, they used to come to this country to work, to do some locum work, other things. But I think there's some problem in recently now after it's not coming in the EU for the UK. So I don't have any answer. But I'm sorry for I'm not able to answer you rightly.
No problem. Maybe Deepak can answer because he has answered just a second back.
Yeah. So here, see, I have recently researched about this topic, and I have also put on my YouTube channel about this, that the German qualification, German Facharzt, comes under the relevant foreign qualification, which is mentioned on the GMC website, the General Medical Council's website. And since this comes under GMC as a relevant foreign qualification, these people can directly work as a consultant over there with the language exam, after language exams like IELTS, or one can take the occupational English test as well, the OET as well. So with these, your qualification becomes equivalent to a German first day consultant who works in the UK. You don't have to go through FRCS or those things.
Okay.
Very good. Thanks Deepak. So let's move forward now.
Yes. Scope of oral surgeon in Europe, I mean, the scope is very high. As I said, the entire Europe is like searches for doctors and specialists. I can tell about Germany. Certainly the oral surgeons are, I mean, as I said that we have a consulting company, we have many candidates, dentist candidates. So it's a good scope. How to get opportunity in Germany in medicine field? I mean, first here I would go a little one step philosophical. To get an opportunity or to find one. So if you search for an opportunity, find one opportunity. I don't know how to answer this question.
No, I think we have answered this, that I would consider this, that what is the process to get into the admission into the medicine. So like we had a presentation, so I explained that what are the steps. So let's consider from that perspective, but one has to really plan. You have to think yourself whether you want to pursue medicine in Germany. That is the first thing. Once you are clear about it, you will definitely find helpful information. And the presentation that I have shared and the Suman has explained some of the insight also.
How to work in UK after MD in Germany? We just talked about this, to work in UK after MD in Germany.
Yeah.
How can an endodontist practice in UK and Germany? The process remains the same for all the dentists and dental specialists, as we have discussed so far in last like 2 hours or 2.5 hours, that you have to apply for license wherever you want to practice, UK or the Germany. You apply for license and follow the pathway, and that way you can find a job. How to do veterinary doctor course in Germany? Veterinary doctor, I don't know. About doctor, we have already discussed.
Yeah, sorry, I also don't have veterinary information, and we don't have any speaker from that domain today, unfortunately. So sorry for that.
I'm a medical graduate from Ukraine and just arrived to Germany looking for internships or jobs. I hope this seminar will be useful and enlightening. I hope that this seminar was useful and enlightening to the viewer.
And just Deepak want to mention that people have been registering from Russia, from Ukraine, from Georgia, from Iran, from several countries. So it is quite, I think they are getting quite information, I think, from us.
Wonderful. PG after MBBS abroad. This was just the, can you make the sense of this question, comment?
I would say that we have discussed at least about Germany, and also we have, I think Sinhaji has discussed about UK, and the process was well explained by you, that once you have an MBBS, then you have to go to this Fachsprachprüfung and Kenntnisseprüfung. So you have explained all this in detail in your presentation. So
wonderful. So is a post-graduation degree, FOID, from Germany recognized in India? If not, what is the procedure to get it recognized or work back in India? Here, I'll tell that, okay, directly right now, the FOID is not recognized by the Indian authorities. It used to, people mention many times that MCI section Schedule 2 Act 1956 and many things they mentioned about that, that some university from Germany was recognized, some were not recognized, but that does not make sense to have some recognized, some not recognized. And now the MCI is also not there, so they are not very clear on whom to recognize, whom not to. As I mentioned, if one wants to definitely go back to India, there's a way that get your FOID in Germany, go to UK a couple of years, and then with the UK degree, you go back to India, if that has to be there. But I think that since the Germany is one of the developed countries and the training is considered high standards across the globe, that way, if people apply, like so far in 2012, people actually started applying to for PG in Germany. Before that, Germany did not open its door for non-European doctors. So the batch which came here initially is about to finish their training, or like in that phase. So so far we have not heard about people who have gone back. Okay, but once people keep trying there and asking the authorities, I think there will be a way out, and authorities will give you a way to practice back in India. But otherwise, we have another way through UK, as I mentioned. I would like to know the worth of PG training in Germany worldwide, and is it possible to get into surgery in Germany for non-EU graduates? The worth of PG anywhere in the world is very high. I mean, you become a specialist, you can do many things which as MBBS you could not. Your knowledge increases, your employability and payability increases. That is the worth of it. And about getting into surgery for non-EU graduates, I believe that, yes, certainly the possibility is still there. It was there 5 years back also, it is there now also. And I hope and I think that in next 5 years also, there will be a possibility for candidates from non-EU country getting into surgery in Germany. Entry in Germany for a job as a surgery specialist. Here, I assume that person is already a specialist in his country and wants to work in Germany as a specialist. For that, unfortunately, you have to go through the entire process of licensing. That is a Fachsprachprüfung, Kenntnisprüfung. Then you can apply for Gutachten. Gutachten is an assessment. Assessment means that you can provide entire data that you have done, your experience letters, all those things, and they will go through it in detail and find out that if your training, your experience matches to that of the FOID's training of 6 years training here. Accordingly, they will find out the deficits, and then they might reduce some duration from your training of 5 years, 6 years, whatsoever. They might reduce it, or they might say that no, they don't recognize it totally, and you have to completely repeat your residency in Germany. So this is you cannot directly work as a specialist with your foreign specialty training in Germany. So course abroad after BHMS. BHMS, I also get this very often. BHMS, BAMS doctors from India who get married like to people working in Germany and now wish to consider their careers in Germany. Here, I say that one has to understand that homeopathy, Ayurvedic, even though in the history and the ancient times, people say that, okay, these are born and raised, I mean, these fields have evolved from like, I don't know, some people say the homeopathy is evolved from Germany. How come Germany does not recognize it as medicine? But at present, that is the situation, that Germany does not recognize homeopathy as a field of medicine. It is recognized as a field of therapy, like as a wellness, as a holistic medicine, like that. So one can work in such clinics, the wellness centers or something like that. But you cannot work in a hospital as a doctor, and the insurance also does not cover it entirely. So that is about the BHMS. There are certainly many courses of basic. I mean, BHMS is a graduation in sciences. So there are courses which can be taken as a postgraduate courses, the university courses I'm talking about, not the clinical ones. One can take such life science courses. One can find that on DARD website or just Google that. I'm not very well versed with that. So these were the questions that I had received, and I thank you all for the questions. I have been tried to take questions very fast and only give the relevant, in one sentence answer that can be there, because many questions we have discussed for 3 hours for so long. So I hope this is useful.
Thank you very, very much, Deepak. It was a very, very, let's say, to the point answer. So I really appreciate that. And we are already like quite far away, but a couple of last questions that I want to still take up. But in between, there is information from Suman that he has reminded us that the process remains same for veterinary bachelor courses. So whatever we have discussed, how to do the bachelor in medicine, that remains same also for the veterinary.